The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Welcome to Health for a Lifetime. We're glad you joined us today. Our program today is about asthma, and asthma impacts many people with their breathing. Talking with us today about this is Dr. Victor Harry. He's a specialist in internal medicine. But before he took that residency, he had training in allergies and the immune system, which is, of course, directly related to asthma, isn't it, Doctor?
That's correct.
We're glad today we can talk about this, and hopefully you can increase our breath, our breathing, help people maybe, avoid this, or I don't know. We're going to learn a lot of things, I'm sure, from you today. First of all, we want to learn, what is asthma? What's our working definition? What's asthma?
Asthma is the inability to breathe well, resulting from two things. One, inflammation in the lungs, and spasms in the lungs. So that what happens in that case is that the person who does have that disease has difficulty in breathing and unable to catch his breath. It manifests itself in different ways. It might manifest as a cough, as chest tightness. It might manifest itself in audible wheezing or shortness of breath.
So you've talked also...
So the two main components are inflammation, and we cannot forget that, because that's the most important part of its treatment. And the other part is spasms, where the tiny muscles of the bronchial tree go into tremors as a result of the environmental changes.
So those two things, and then you started to just hint at what the symptoms are. Of course, shortness of breath. What else?
Cough, shortness of breath, cough, audible wheezing, tightness in the chest. Any of those things may be manifestations of asthma.
So going back to your first point then, the definition was, of course, some kind of process, inflammatory
it's a process in the lung that consists of inflammation and at the same time a hyper-responsiveness of the lung. And we say hyper-responsiveness because the tiny muscle, the smooth muscles in the lung tree go into these spasms and prevent the person from breathing freely, so that not enough air is going in and not enough air is going out.
So that would be the causes of asthma, the real cause. Or when we talk about causes, that's different than this, isn't it?
Well, that's what it is. The cause can relate from the environment. For instance, there are people who have allergies, and allergy may be a cause, a precipitating factor. So that things in your environment bothers you. First of all, you begin by sneezing and then wheezing. See, what happens in the lung, there are some cells, there's some mast cells or some T cells. We tend to break up. When these cells break up, they release substances into the body. And these substances into the body that they release cause the inflammation. And in addition to causing inflammation, they cause the spasm. Okay. So that's the simple physiology. So that when the air goes in, the air is going in, but the person can't breathe properly. And what happens is that the airway constricts. So the normal area gets smaller and smaller, and the person has difficulty breathing.
It's probably one of the most alarming things that can happen to someone.
It does, and there's an increase in asthma. And the increase happens in areas of high pollution. Because we find that the presence of pollution in the air, sulfur dioxide and carbon dioxide, those act as irritants. People who work in dusty areas and may have some predisposition to the problem, we find that they end up having those problems. Now, there's the asthma resulting from allergies, especially in the spring when the flowers come up and the tree pollens come up. Now those things are inhaled, and as they enter the system, the body tries to fight it. Very interestingly, in the body's trying to fight it, the body produces substances that are deleterious to the body itself.
So in other words, this is really, it's healthy in one sense because the body's saying, wait, this is a toxin, let's get rid of it, but then it's too much of a good thing.
That's right. And so what happens, it overwhelms the body because the antihistamines, the mast, these are protective cells that we have called mast cells. And these mast cells, when they split up, they release histamines. And the histamine and other substances that are released by these cells cause the problem that we see.
You've already kind of answered this question, but talking about who can develop asthma, of course, someone in a polluted area, someone in an area where there's lots of pollens and these different things you've mentioned. But are there other people that are
predisposition?
Yeah, what is
now,
that?
Now, if there's a family history, and it goes back to the family tree, if there's a family history of asthma, then one must consider, if you have a son, for instance, if you're an asthmatic or your grandmother was an asthmatic and your son starts coughing every night, it's not just a simple cough. You must explore whether or not that child has asthma. And one of the things that happens is that asthma tends to occur primarily in children, maybe in the early morning hours when you notice that your child is just coughing every night. So parents would bring their children and say, John coughs every morning around 2 or 3 o'clock, coughing all the time. And that's an indication that's asthma. Now, why early in the morning?
Yeah, why is that?
Now, the reason is that based upon the body's circadian rhythm, the cortisol level of the body drops early in the morning.
And the cortisol is a treatment for...
And the cortisol is a treatment for it, because the body produces its own cortisol.
Okay.
And helps you to overcome those kinds of things. But when the level drops, people who have predisposition to the disease and have irritants, maybe dust mites in the house where there's dust. So the internal pollution, by internal I mean in the house pollution, molds, dust mites, those are things on the inside that people who have asthma need to be very careful about. And
excuse me, what about a person that has like eczema or other types of allergy type things? Are they more predisposed to asthma?
Yes, there are a certain percentage of people who have eczema, and eczema is a skin allergy. So a certain percentage of people who do have eczema have asthma. That's because they're susceptible to allergies.
And that's, I guess, a higher percentage.
A higher percentage than the normal population.
So the people then that are at risk or who can develop asthma are those with a family history, those in the right or should we say wrong environment, and those that are anything else.
Yeah. Now I want to make this one point as I'm answering your question. Now, asthma manifests itself as wheezing.
Okay.
But all wheezing is not asthma.
Okay.
And the reason I'm saying that is because the story is told of a little boy who was wheezing, and his parents thought that he had asthma, only to find out when he went to the doctor, even though they gave him medication, he continued to wheeze because a small object went into his lung.
Okay.
And that caused the wheezing. So all wheezing is not necessarily asthma.
That's why they got a chest x-ray.
That's why they got a chest x-ray. And they did a chest x-ray on that kid, and as a result found that object in there.
So we've talked about the causes and who can develop it. What are some risk factors, or has that already been covered in what we've talked about?
Well, the risk factors we talk about are people who are predisposed, people who have allergies. If you have allergies, it means that you should have your allergies treated, because there's a continuum between allergy and asthma. So we have found that kids who have allergies may move on to develop asthma if their allergies are not taken care of.
So so if you see a kid that has eczema or other allergies of any kind,
right,
they don't get better. They sometimes can get worse, and one of the things is asthma.
That's right. That kid should be taken to his physician, his or her physician, so that steps could be taken to reduce the possibility, because the irritant on the outside that causes the allergic response, remember that asthma also is an allergic response. And as the body responds to that offending allergen, and I use the word offending because it causes a negative response in the body. So the pollens of the air pollens, the grass pollen, the tree pollen, the dust in the house, the molds, leaky roofs, any of those kinds of things that you have in your household, that should be gotten rid of because they can predispose a person to developing asthma.
So why would a leaky house do that?
The mold spores grow. Yeah.
I see.
Yeah, and by inhaling those spores, it irritates, causes the inflammatory process, and then the response to that would be wheezing or asthma.
I mean, it's fascinating to hear that as a nurse and also a minister, because, you know, in the Old Testament, they have a whole chapter about sick houses, and they get so sick sometimes they say, hey, if they have this much in it, knock it over.
That's right.
He was an allergist. God's an allergist, too.
That's right.
So what are the effects of asthma on your body?
Now, I'm glad you asked that question, because for children, it affects their concentration. So that's one of the other thing is, certainly, it can result in death, because the death rate of asthma is increasing because people take it so lightly. Okay? So that those who have allergies need to make sure that the allergies are taken care of to prevent the continuum into asthma. So allergies can lead to asthma. Asthma can lead to death. Okay. Asthma can lead to poor behavior problems, because a child who has asthma all the time, he can't concentrate, and as a result of that, he manifests bad behavior because of his inability to concentrate, and he's pushed aside.
So he starts to act out as a result of that.
As a result, right.
So how does it really work that he can't concentrate? Because he's wheezing, he's doing this, but he's doing that, or is it because the oxygen level is low in his brain, or what?
You've raised a good point. Because the presence of asthma, active asthma in the system, reduces the oxygen level. It certainly does, because that's the whole thing. When you're wheezing, you're not getting enough air, you're not getting enough oxygen. And because you're not getting enough oxygen, it is being choked off. Your brain, therefore, is not at its maximum. So you can result in death.
Right, so the concentration goes down, and there's an increase in irritability because of that. And so it's not, you don't spank the child, you say, wait a minute, there might be something more.
Something is going on, that's right.
Okay.
That's right.
Now you keep bringing up death, going from concentration to death. I mean, I know there's an intermediate stage, but the reason you do that is because there can just be sudden death from some, an asthma attack, I'm sure you're
That's
talking.
right. The reason I bring death is because that's the ultimate. And because the death rate of asthma in the United States is increasing. Even though we have the medications that can treat the disease. Okay? So it means then that we are not paying enough attention. And so we need to pay more attention to the asthmatic, to the children who maybe, a child who has asthma may be extremely quiet one day, and you wonder why the child is quiet. The child may not be able to breathe properly, but it's just being quiet because of the inability to breathe.
I see.
Okay? And so we must pay attention.
Are there population or ethnic groups that are more susceptible to asthma than others?
What we do find is that the central cities, asthma is increasing in the central cities, and those populations who live in the central cities, in Los Angeles, in Washington, D.C., Baltimore, Maryland, Chicago, we find there's a higher incidence of asthma. And the factors are many. Number one, pollution.
Right, in the city area.
In the city area. You know, the cars, the carbon monoxide, the carbon dioxide, all of those things. Secondly, the housing nature of those inner cities. The actors, because of the poor housing, you have irritants. I mentioned molds earlier on. Cockroaches. That can cause asthma. Yeah.
Is that right?
That's right. So if your house is infested with cockroaches, then you need to get rid of it, because that can cause asthma. So we found that mites, which is in the dust mites, cockroaches, those are things that you find particularly in inner city places, or places that are not well kept.
We're talking with Dr. Victor Harry. We're talking about asthma, and we're learning some very interesting things. We're starting to get a hint that though it's a bad problem, there are some things you can do to slow it down, perhaps stop it. We're going to talk about how you can prevent it, perhaps treat it, control it, turn it around when we come back.
Are you confused about the endless stream of new and often contradictory health information? With companies trying to sell new drugs and special interest groups paying for studies that spin the facts, where can you find a common-sense approach to health? One way is to ask for your free copy of Dr. Arnott's 24 Realistic Ways to Improve Your Health. Dr. Timothy Arnott and the Lifestyle Center of America produced this helpful booklet of 24 short, practical health tips based on scientific research and the Bible that will help you live longer, happier, and healthier. For example, did you know that women who drink more water lower the risk of a heart attack? Or that 7 to 8 hours of sleep a night can minimize your risk of ever developing diabetes? Find out how to lower your blood pressure and much more. If you're looking for help, not hype, then this booklet's for you. Just log on to 3abn.org and click on free offers or call us during regular business hours. You'll be glad you did.
Welcome back. We've been talking with Dr. Victor Harry. Dr. Harry is a specialist in internal medicine. Before he did that residency, however, he did study in allergies and the immune system, which is directly related to asthma, as we saw in the first half of our program. We saw that this is a huge problem in America, and you said it's only increasing.
Yes.
People don't take it seriously enough. They don't recognize the connection between the allergic system or allergies and how it can lead on to asthma. And you really have a burden for this, and rightly so. You live in an inner city. You talk with people that are in poor houses and all these different things we talked about in the first half. We want to talk about detecting asthma and then perhaps treating it, turning it around, and what types of things we can do. You've hinted to some of these things, so let's focus in on it.
Now, how do you detect it? Now, in talking to the parent, if you notice that your child has some difficulty in breathing, or if you notice that your child has shortness of breath, or if you perhaps notice that your child may have excessive runny nose, take the child to the doctor. That's the first thing. Now, the doctor then makes the diagnosis by doing a special test called a pulmonary function test. That is where the doctor asks to have that child breathe into a machine, and then based upon the breathing test, the doctor can determine certainly that this child or this person or this adult has asthma. Now, we talked earlier on of the components. Now, in the two components that I mentioned earlier, one is the inflammatory component, and the other one is the irritable component, or the hyper-irritability component, which with the muscle fibers just go into spasms. It is important to note that in treatment, in today, we have found out that the most important component, both components are important, but the most important one is the inflammatory component. And so in the treatment of asthma, one uses corticosteroids as the mainstay of the treatment of asthma today. Because it takes care of the inflammatory component of the disease.
Is there any downside to taking corticosteroids?
Generally speaking, no. There is a downside if you take high doses for long periods of time. But at the low doses in which those the steroids are inhaled, there's virtually no downside. Studies have been done on the growth of children, and we find that in taking in the appropriate amounts, they grow normally. Certainly, if you have to use high doses over long periods of time, that can affect the growth in children. Or in adults who have very bad asthma, they can develop, as part of the secondary cause of using high corticosteroids, you can develop cataracts, you can develop diabetes as a result of taking high doses of corticosteroids. You can develop hypertension because corticosteroids tend to increase blood volume. But we're talking about the extreme here.
Right.
That's very, very high doses. But under normal circumstances, no.
Okay. So the detection, we've talked about that. Now, you know, some people are very interested in plant sterols when they have their kids that have eczema or different things. There's a lot of these substances you can buy in these health food stores and whatnot. My feeling is that you need to go to a trained professional and get it checked out. How do you feel about this?
That's very important. Go to the trained professional, have it evaluated and diagnosed and treated, because it is too serious a disease to play around with.
So the treatment then you've alluded to can be the steroids.
I mentioned one of the treatments,
right,
and that is the use of inhaled corticosteroids.
Okay.
And the other is the use of some beta-adrenergic agents, which are used in inhalers. And that is more for the rapid response.
Okay.
So if a person is wheezing, you need a rapid response. And in times past, you give an injection of adrenaline. Now we have other substances that you can use. They inhale them. You can use a metered dose inhaler, or you can use through a nebulizer. Well, that's a little cup in which you put the medication and the person inhales that back and forth. So those are things that we can do to treat the disease in the active state.
And in that active stage, let's say you're up on the mountain and you don't have your medicine with you. What do you do then?
Well, you better have your metered dose inhaler. But I understand that in some cases people are told that if one has an acute wheezing process, they can use the Heimlich maneuver to enable that person to breathe better. But I have not studied that to a large extent. But
Sure.
I understand that's one of the things that could be done.
But get down the mountain.
Get down the mountain as fast as you can. Get yourself to a doctor. And if your child has asthma and he or she is going on a camp or an outing, be sure that you have the medication.
Now, sometimes, you've got the inhalers. Is there any oral medication people take to deal with this?
There are oral medications that can be used for it, but we tend to be moving away from oral medications more to the inhaled, because what happens with the inhalers, you provide the medication directly at the point of need.
I see.
By taking a lot of oral medications, what happens, and we still use oral medications.
Like theophylline?
But those are old medications that you use systemically.
Okay.
And we're moving away from that now.
Is that right? So
Yes.
they don't check their blood levels and all that stuff?
No, those things are...
They're moving away from that?
Yes, we are.
Now, what about then, we've done a lot of education in this program, but what additional things do you tell your patients when they come?
Now, one of the things that we need to keep in mind is that the environment must be clean. And so a dusty environment to an asthmatic is a gun to a person's head. So which means that the environment must be free of dust, free of inhalants, right? Free of molds. We talk about mold spores and how they act as irritants.
Cats?
And pets, in some cases. Now it's very hard to get rid of pets, but one of the things that we do today is that we skin test that person for allergy to the pets, be it a dog or a cat, and then provide immunotherapy if that child or that adult doesn't want to part with that pet.
Is that right?
But yeah, so we try to give immunotherapy to that person, hopefully that they can overcome the offending nature of the allergy to the pet.
So, allergy testing, they have hundreds or thousands of things you can test for. Do you run those kind of things in your office?
Yes, but what happens is, depending on, if you're dealing with internal, in-house allergies, as opposed to allergies on the outside.
I see.
So you can test for pollens, and different regions of the country or of the world, you test for different things. So the trees that grow up in northern Canada are not the same trees that grow in Florida, or the trees that grow here in southern Illinois are not the same things that may grow in California. So you test for things in your environment.
What's the best place to live in America if you're an asthmatic?
Wherever you can live.
So you just have to test it out.
You have to test it out. Some people move to Arizona, for instance, because they have asthma when they're in the Northeast or someplace else. But sooner or later, because they have that predisposition to allergies, sooner or later they develop the allergies in the area that they move to.
Now, so in other words, you can run, but you can't hide. Okay. You practice lifestyle medicine. You're a board-certified internal medicine. You practice with a group of physicians there in the D.C. area. But you always try to address things through lifestyle type things. Changes. And a lot of these things had to do with that. Looking at your environment, your housing, looking at the different things you come in contact with, treating allergies you've talked about.
That's right.
Any other lifestyle type things that you would say in a general sense, then more specifically with asthma?
It's important too not to change activities. In other words, a person who's an asthmatic should exercise.
Okay.
There should be no reason why the person should not exercise. And also there's exercise-induced asthma in people who are prone to that. But these people can take the medication before the exercise so that during the exercise they do not get the asthma attack.
So don't stop exercising,
don't stop
but
exercising.
make sure you're equipped for the exercise.
That's correct.
And
so
what else?
Exercise, take care of your environment, remove any offending agents in your house, and eat properly. It's important to eat properly too, because there are some things that do predispose. I think earlier on we might have spoken about the ability of white blood cells to phagocytize or to carry out its function.
Okay.
And you know, if you eat certain diets that prevent white cells from carrying out its function, that predisposes you to other things. Now, why am I mentioning that with asthma? Because in the case of asthma, you need white blood cells too. And those white blood cells do release certain substances that may cause problems.
Okay.
So diet is important, even in this.
All right. What about fluids?
You must drink a lot of fluids. It's always important to drink a lot of water. Water, because water keeps the body hydrated. The person who is asthmatic, the person who is wheezing, loses a lot of water. Remember, just from regular respiration, we lose approximately 600 cc's of water, which is about 2 8-ounces glass of water, 2.5 8-ounces glass of water, just from ordinary respiration. Imagine if you were breathing faster, as if you're running. So you need being hydrated.
What about anxiety as it relates to asthma? Anything about that?
Stress. No, that's one of the things that can. As a matter of fact, I was reading recently about the effect of stress on children who are asthmatics, or on anybody for that matter. So that can create anxiety. So as much as possible, relieve the stressors. Get rid of those so that your life can be healthier and you can breathe better.
Dr. Harry, we're delighted that you could spend time with us at 3ABN and do this program on asthma as well as the others you've done with us. And this has been very meaningful. We want to give our special thanks also to your wife, the other physicians there that allowed you to have the time off. We're glad you could join us.
Thank you very kindly.
And we're grateful that you could join us as well today for this important program. We've learned a lot today about the breath and as it relates to asthma. We, you know, underneath all of this, are thankful to God who gives us the ability to breathe to begin with and has set us up to learn about Him through that. We are really dependent for every breath on our Maker and our King. And we hope today, as a result of this program, you'll have many more breaths and can serve the Master.